So the evidence is overwhelming that LDL is the pivotal risk factor for atherosclerosis. If we look at patients with familial hypercholesterolemia, particularly those with the severe homozygous form of FH, they get severe premature atherosclerosis. But now with the advent of newer drugs, particularly the PCSK9 inhibitors, we are getting the LDL cholesterol levels down to levels we've never seen before. And the real question is, are these very low LDL levels safe? We're now getting to LDL levels of below 1 millimole with the new PCSK9 inhibitor therapies. So if we have to go back a bit and think when we're born, we're actually born with an LDL cholesterol of about 1 millimole per liter, a total cholesterol of around about 3, and we function totally normally. But what happens during our lifespans is probably from a loss of LDL receptor function. There's a slow but gradual increase in the LDL cholesterol level, which results in atherosclerosis in our mid-years, in our 40s and 50s. So what we're really doing with the PCSK9 inhibitors is returning the LDL cholesterol levels to probably what it should have been when we were born. And that's very similar to the primates. Most of the primates, animals, elephants, have LDL cholesterols around about 1 millimole per liter. And interestingly, the patients that we've discovered that have loss of function mutations in PCSK9 have LDL levels of around about 0.4, 0.5 millimoles from birth throughout their lives, and have no adverse effects from these very, very low cholesterol levels. So the PCSK9 inhibitor trials are really showing us that what we previously thought from a low LDL cholesterol, the increased possibility of hemorrhagic stroke or suicide or cancer, has not been borne out with the PCSK9 inhibitor trials. The only signal is possibly neurocognitive dysfunction. But at the moment, there's not really a true outcome or a study designed to specifically look at neurocognitive function. There is a study called Ebbinghaus, which is underway at the moment, which is more precisely looking at neurocognitive function. But at least in my clinical experience with PCSK9 inhibitors, I have not seen any major effects on neurocognitive function. So I think the future looks bright. We are now getting to very low cholesterol levels, and I think we're really going to be benefiting patients and having a major impact on atherosclerosis and cardiovascular disease.